Hello, everyone. A very warm good afternoon to everyone. To the Evaluation Conclave 2022, Equity and Transformation Evaluation in Challenging Times. I'd like to welcome you all to this interesting event that we will be having for the next 3 days, which is being hosted by the community of evaluators, South Asia, in collaboration with Sambodhi. We'd like to begin today's events with requesting our guest of honor and our keynote speakers to take the seat. I'd like to welcome Mr. Anthony Syriac, the Director General for Development Monitoring and Evaluation Office, Niti Aayog, Government of India. Next, I'd like to invite Dr. Sonal Desai, who's Distinguished Professor, University of Maryland. Please help me in welcoming Mr. Luigi Di Aquino, Chief of Health, UNICEF India. And next, we have Dr. Shagun Agarwal, who's South Asia Region and Global Monitoring Evaluation Learning Director for Women Lived Health. To just be joining us shortly. I'd also like to welcome and request Mr. Cheladurai Solomon, Chairperson, CEO, Community of Evaluators South Asia, to take the seat. As we begin this afternoon, we'd like to start our ceremony with a very small initiative of lighting the lamp. For that, I'd like to invite all the delegates who've taken on the dais first, and as well as I'd like to invite some additional members who've been important contributors in the event. Please welcome Dr. Shagun Sabara. I'm so sorry. For lighting the lamp, we'll like to welcome all our guests on the stage, as well as invite the CEO for Sambodhi, Mr. Dharmendra Chandrakar, to the stage, as well as the Community of Evaluators South Asia board members, and the Director for ISST, Ms. Janvi Andharia, and the ECOI leader, Rashmiji. Please welcome and come join us in lighting the lamp. Thank you so much, guests, for taking time out for that. As we begin these next few exciting days, we have a lot of interesting sessions planned for all of you for the next 3 days. We'd like to invite Mr. Cheladurai Solomon to make the opening remarks and let the session begin.
dear speakers, participants, and colleagues. Good afternoon and welcome to the 5th Evaluation Conclave organized by the Community of Evaluators South Asia, together with partners from South Asian countries. After a hiatus of 4 years, we are pleased to return with an especially remarkable event being held in India, Bangladesh, Bhutan, Nepal, and Sri Lanka. Every conclave is given a thematic focus, and this year we have chosen the theme Equity and Transformation, Evaluation in Challenging Times. We are in a society where there is inequality of opportunity, access, distribution of wealth, and ownership to resource. The recent pandemic has exacerbated these inequalities. It has also led to increasing injustices and weakening of rights. Although these issues are global, they are especially severe in South Asian countries where economies are not bright and poverty is a major issue. While there have been improvements in living standards and increasing productivity, income levels, and life expectancy in these countries, we also see widening gaps in the standard of living and quality of life. There also continues to be discriminations based on caste, gender, ethnicity, and religion. The pandemic also reversed some of the hard-won progress achieved by these countries. We witnessed how migrant laborers and other socially marginalized groups were especially hard hit. As we brace for a possible global recession, the vulnerabilities of these groups are bound to be forefronted again. It is in this context we feel that evaluation should play an influential role in the transformative process, ensuring equitable development outcomes to all. To do this, we must keep complex issues of inequality in societal structures in focus. We must focus on designing evaluation frameworks and assessments that provide an equal opportunity to evolve and bring and incorporating stakeholders' perspectives. Finally, we must constantly evolve and bring innovation into our evaluation approaches to address complex challenges in times of crisis like what we have witnessed lately. The 5th conclave is designed as a hybrid one. We have physical events in 5 countries between 12 and 14 October. The day's event in each country will include skill development workshops, keynotes, and expert panels. There will be 12 workshops, 5 keynote sessions, and 14 panels focusing on the thematic strands of the conclave. We have nearly 75 keynote speakers, workshop facilitators, and expert panelists who will share their knowledge and experience with about 350 participants. We expect that the efforts of the organizers, collaborative partners, donors, and evaluation experts will catalyze the thinking and skills required to commission and conduct evaluation in challenging contexts for a just and equitable society. Let me conclude by acknowledging and thanking our governing board, OPE hosting partners, and the donors. On behalf of COE, I would like to wish all the best for a meaningfully successful Conclave 2022. Thank you.
Thank you so much, sir, for setting the stage and initiating this very needed occasion for holding dialogues and traversing the gaps so that we can solve the challenges ahead for evaluation. I'd like to invite now our first keynote speaker, Dr. Sonal Desai, who's a professor of sociology at University of Maryland, She's a social demographer and holds expertise and interest in social inequalities in developing countries with a particular focus on gender and class inequalities. She studies inequalities in education, employment, maternal and child health outcomes by locating them within the political economy of region. Please welcome Dr. Desai.
Thank you. Thank you for the invitation to participate in this conclave. It's, as we know, it comes at a challenging time, and we are dealing with a sort of a challenging world in which a lot of rethinking of fundamentally what we do in terms of public policies, how we evaluate will need to be done. Let me start with a story. In 1991, in Rajasthan, one of the most innovative programs was born, Lok Jumbish. Some of you, one of the good things about aging is that I remember this, and for many of you, this is purely new. So for those of you who haven't heard about it, actually read, okay? Lok Jumbish was one of the a really innovative program. It was led by the former Union Secretary of Education, Anil Bodia. And it was a participatory program with a focus on education for marginalized communities, for girls. And the notion was that the community must participate in developing and administering this program. It was funded at that time by Swedish assistance agency, SIDA. And it was extremely wildly successful, actually, okay? 1998 came, India became member of the nuclear club, and SIDA withdrew its funding from this particular program. The program got absorbed into the government as a part of a Panchayati Raj ministry, and then sort of came under Ministry of Rural Development. It lost its participatory nature. It became sort of absorbed in more of a structural, well-structured programs like Sarva Shiksha Abhiyan and so on. It lost its participatory nature. Education and enrollment in Rajasthan continued to grow, okay? But the whole focus on empowering the marginalized communities and girls was kind of fell by the wayside. Now, Vimla Ramchandran did an evaluation of this particular program, and there was a comment that she wrote, which has always stayed with me. She said, did the program have a genesis of or seeds of its own destruction within the way it was structured? It was structured as a participatory program, a very intensive program. And in order to scale it, it needed to be part of sort of a larger and bigger government machinery. So if the whole purpose of the program is community ownership and participation, and then you want to scale it up, are the two things sort of compatible with each other? Okay. And that brings me to the key point that I want to make today, that we kind of need to understand the processes through which we expect the programs to work, and whether these processes themselves can be sustained as they get scaled, as they get transferred from one place to another. This, I think, is a key issue for anybody dealing with evaluation in modern world, because today the gold standard is randomized control trials. RCTs don't really worry about processes. They just as long as you can randomly assign people to control an experiment group, you can kind of look at what is happening between the two groups, and that should be enough to give you the whether the program is succeeding or not. Unfortunately, that approach also does not lend itself to scaling. And this is where we are seeing a lot of challenges around the world, not just in India. Okay, I mean, it's a global challenge where unless you understood the process through which you expected the program to work, we do not know if the massive scaling or expansion of programs work. There is another interesting example about early childhood development program that was developed in Jamaica. Okay, it involved the home visits by instructor to the households, so to work intensely with mothers to develop enrichment curriculum that would help marginalized children. They did it in Jamaica for 70 children, very successful. It was done for 700 children in Colombia, modestly successful. It was expanded to 70,000 children in Peru, okay, very little success, okay. The problem is that if we are relying on committed, well-trained teachers to deliver these services, when you start expanding, you're not going to get those committed and well-trained teachers. What we need to be able to do is to sort of understand from the beginning, what is the purpose of the program, and devise the early trials in such a way that when you scale them up, they retain their character. They don't become very difficult to administer, right? So if you needed to hire 10 committed teachers, you can easily hire them in, say, Delhi, okay? We needed to hire 100,000 committed teachers. That would be very difficult because how many people would be available, okay? How would they be supervised? How would they be monitored? Or supported. And so in some sense, the challenge of scaling comes with having a structure that we haven't often thought about. The second problem is that there is an enormous amount of ideology that drives our field. Okay. And sometimes we are unwilling to abstract out of those ideologies to actually think about, how these processes might work. In the post-COVID world, okay, South Asia is the region which has had the longest school closures. Okay. And we know that there were negative effects on learning outcome of the school closures, which is fine. Or it's not fine, but at least that we all acknowledge and accept. The question is, did it really prevent the transmission of disease? Okay. We don't have any real way of studying it, but Sweden has a very interesting experiment. What they did was they had online instruction for older children in the upper middle school who were able to study online. And they had in-person instruction for younger children, lower secondary school, okay? And there was a study which looked at the disease transmission associated, looking at parents of children who were getting online instruction versus parents of children who were getting in-class instruction. And there was very little difference in the disease transmission between these two groups. So what happened is that you can control where your child goes, okay? Even that's pretty hard to control, as most of us control it in some ways by not opening the school. But parents are exposed to many other things, right? And so the whole idea that you can control the exposure of one person in the household and protect the whole household doesn't necessarily make sense. Had we done sufficient thinking about the process of disease transmission and not sort of gone with this gut instinct of let's shut down the world, okay, would we have thought differently? Let me touch another holy cow which falls in the same category, the microcredit. Okay, I think in South Asia, there is just this incredible belief, and so is around the world, that microcredit programs are the panacea to the poverty of the rural population. Increasingly, what's been happening is that pretty much most of the evaluation programs, including those done by JPAL, find that the income increase associated with microcredit is very limited. It does protect consumption. It may reduce loan taking for consumption, so which has the positive effects in itself, but it's not necessarily resulting in increase in incomes of the beneficiary groups. Okay. And again, if we thought a little bit about it, we might have looked at whether credit was really the constraint for growth of some of these micro enterprises. Okay, then we might have started with a different mindset. Okay, so in some sense, I think that what I'd like to do is make a pitch which says, let us look at processes that are supposed to be working. Look at it from both the population and average population, as well as sort of more vulnerable and marginalized groups, and see whether these processes are can be addressed through the programs and policies that we are undertaking, and to see how it might be scalable or not scalable. Let me turn a little bit to the evaluation process. Okay. One of the challenges that often happens is that when we undertake evaluation and we don't find the results as we expected, we decide to blame the beneficiaries because they somehow misbehaved. Okay. As an example, India scaled up its food subsidy program massively. Okay. First, there was in around 2004-05, there was the normal public distribution system that was targeted towards the poor. Over the next 7 to 8 years, it expanded in a way because the market prices were going up for the food grains and the PDS prices remained low. So the number of people who were using PDS grew rapidly. And in 2013, we put in place the National Food Security Act, which now covers or supposed to cover 66% of India's population, 75% rural, 50% urban, and so on. Some of the work that I did looking at the improvement in nutritional outcomes between 2004-05 and 11-12, before the NFSA was implemented, but when the program was growing, looking at the people who had below poverty line cards so that they had access to subsidized food grains, we saw no improvement in children's nutritional status. In fact, a mild deterioration. Okay. And so I kept thinking, yeah, this can't be true. I mean, there must be something wrong with the data that I'm looking at. We must have done something wrong. So we did some analysis on it later on, looking at what happened to people in their food consumption. And what we found was that because the PDS was providing rice and wheat, okay, people started consuming more rice and wheat, and at the same income level, if they didn't have the below poverty line card, they might be using spending money for milk, fruits, etc. When it came to people who had access to below poverty line card, they were sort of focusing on rice and wheat, which we know is not it gives you cheap calories, but it doesn't necessarily lead to nutritional improvement. It may be that you can blame them and say, oh, people didn't know. I mean, they really should have used the savings that they got out of the consumption of rice and wheat to get more food that was more nutritious. But, you know, people also have other needs. Okay, they have their children, they want to educate, they have other aspiration. And the money that was being saved was being used for other things that improved family welfare, but not necessarily the nutritional outcome. And the final thing that I would like to add is that sometimes when we don't get the results that we expected, we think that it's because our beneficiaries are not giving us correct answers. In fact, there was a secretary in Government of India who wrote a very famous article in a newspaper claiming that beneficiaries often lie because they want to get benefits. I think that at some level, we may want to actually think about whether our research design actually gets at what people's experiences are and captures what we want them to capture or what we think we are capturing. Okay. As an example, one of the things we have been finding is that in India, women's labor force participation has ostensibly been declining. I firmly believe that at least some portion of it is just poor research design and poor wording of the questions, because often what happens is that the way we see employment is not the way our respondents often see the employment. I, at one point in time, was collecting data in a rural area, and I passed one shop very routinely, and there was a woman who was sitting at the shop and selling. It was a little kirana shop. That happened to be the household that fell within our sample. And when we started doing the survey, we asked her about her employment status, and she said, I don't work. Okay. And I said, well, I have seen you for days on end working here. You know, what is going on? And she said, oh, but my husband owns the shop. I just help him. Okay. The husband is actually a teacher who works in the nearby township. He only comes to the shop 2 hours a day. She runs it most of the time, but she did not see it as work. So one of the things that we did was we developed some sort of experimental design on how to ask questions about female labor force participation that went from more individual perspective rather than the researcher perspective. So we would say, oh, does your household have any farm? Who works on the farm? Do you have any business? Who works on the business? And for the same individuals, we found a substantially higher labor force participation rate. So I guess the plea I would like to make to all of you, okay, is that as we think about some of these issues and as this conference progresses, the kind of things that we want to probably pay attention to is the processes that underlie the programs and policies that we are interested in, the research design of how what kind of a research design we are using, and whether these are scalable programs or not. Thank you.
Thank you so much, Dr. Desai, for those interesting examples and emphasis on the processes. We'll be sure to look up Lok Jumbish. Our next speaker is currently the Chief of Health, UNICEF India. He has over nearly 20 years of experience in working in the international development sector, and particularly in the practices in health sector, contributing to the design, planning, implementation, monitoring, and evaluation of maternal, newborn, and child health policies and programs in Africa and Asia. For years, he has been facilitating the coordination between key stakeholders such as the government stakeholders, donors, UN agencies, and civil society organizations. Please help me in welcoming Mr. Luigi Di Aquino.
Very good afternoon, everyone. And first and foremost, let me congratulate all of you, and particularly the organizers and the forum, for this amazing event. I'm sure you're all excited. We are restarting by meeting in person and more, and maybe getting more and more used to it without escaping one from the other. I also have to, so thank you so much to, on behalf of UNICEF, to the community of evaluators of South Asia, and thank you so much on my behalf for having me here. I will disclose my sins right away. I shouldn't be here, and you should have my colleague Mikey Biker sitting here. Some of you will be conversant with her. I think she's her counterpart. She could not be here, and so this is why you have a chief of health today discussing of evaluations with you. But for the 5 years before coming to India, I was working at the Liverpool School of Tropical Medicine and as an evaluator. So I think I have a bit to share as a victim and as a perpetrator when it comes to the evaluation science, having been on both sides of it. My first reflection is about your subject for this year, which is equity and transformation. Now, for those of you who are conversant with UNICEF, UNICEF is all about rights, children's rights. And of course, women come along because no woman, no child, right? So when it comes to rights, the first word that comes to mind is, and you all know there is a Child Rights Convention adopted by virtually every country in the world, but two, and I will not say which are the two. So when it comes to rights, the first concept that comes to mind is universality. So rights are universal and they belong to each and every child. And when I read, and when we read equity, that's exactly meeting the gap between a universal concept and a practical implementation of it. And when we read as a title, transformation or transformative evaluations, again, transformation is what is needed to bring change into the policies, into the processes, into the belief, to exactly reach that missing gap. And just to remind all of ourselves, we just have 8 years to go to our SDG targets, and we have lost probably a couple of years nearly in full, if not even going backwards, because of the pandemic. So I will share 4 major reflections that mainly stem from UNICEF work on evaluations and the experience the organization, particularly in India, this is where I work, does in terms of evaluation. So first of all, we take it very seriously globally. All of our evaluations are published. There is a website, there are strict tools, methods, guidelines. You can look for it, and it's just one more tool at everyone's disposal on global websites. And we take it seriously because it matters. If rights fulfillment is about behaviors, if it is about policies, if it is about systems, then you need evaluations. Because without evidence, data, and credible, strong, independent evaluations, you don't get to those changes that makes policies or systems stronger or better to deliver to more people. My first point is about the pandemic, where we are coming out from. And I was in the period where we were probably all sitting in empty offices or at home during lockdowns. I was the COVID-19 coordinator for the entire UNICEF's office in India. So my day started at 6 and ended up at 2 a.m. every day. And when I heard the office saying, let's evaluate what you are doing, I jumped off the roof and said, what are you guys talking of now? But yes, it was extremely important. Even then, even in the peak of an emergency, it was important to realize that what we were doing needed to be assessed in real time. Now, we were lost. How do you evaluate if you have been interviewing, doing FGDs or KIIs forever in the villages, meeting the shop woman, and now you can't even leave your house? So, of course, you would lose quality, you would lose depth, and you needed to tweak what could or could not be done. I suppose all of us have found ways to reach, and thankfully India has such a deep penetration when it comes to mobiles, and there are platforms that can help that. So reinventing the access to the people we were intended to talk to was, of course, critical. But then it wasn't sufficient, because we immediately realized, sharing examples, real life, that if you go with your questionnaire on a phone call or on a online platform, it doesn't work. So we really had to rework the language, rework the length, rework the scope of the questions, and essentially minimize the damage of not having a human-to-human interaction. So to say, was COVID a disruption for evaluators as well? Yes, it was. But did we gain something out of it? Possibly, yes, even for future, even when we are now, all of us here without masks. I think there are methods, there are tools, and there are nuanced approaches to collecting data that can be taken forward. The other point on COVID-19 was the getting information in real time, community-based monitoring. That was a big learning for us. Getting information from the ground about the perceptions of communities about what was going on during the lockdown, after the lockdown, and we did that through community volunteers. So we had to reinvent the deployment of this, get the numbers, get the data, get the interviews, and transform them. You can think of Sentinel sites. This wouldn't be representative, but purposefully chosen to be the most remote or deprived areas, and try to use these to adjust programs or to convey to government, to partners, that whatever measure was being taken for COVID wasn't maybe working for some communities. The third innovation it's not an innovation, it's really business as usual that doesn't happen, I believe. We all had to force ourselves into during COVID was reminding ourselves that, especially in this country, we have a huge, huge gold mine of administrative secondary data. And we all jump into the survey, into the interviews, into the focus groups. I think I'm talking now with the ex-hat of an evaluator, but there is so much wealth of data that are often not triangulated, reviewed, quality assured, used to infer about issues or about possible solutions. And when you're locked because of a pandemic, I think you rediscover, and we did a lot of work on that. One example was the macroeconomic impact evaluation of the Schwarz-Parat mission that UNICEF facilitated. And we also did a micro simulation of some of the social protection schemes. And all of it was through data that are existing. So to say again, on my first point on COVID, it added complications. It pushed us to think a bit beyond the usual, and that I want to pass a positive message of not to lose that part. The second point I wanted to make is about how we approach evaluation, and I will link it to processes and program. There are different evaluative methods, approaches that are not so commonly used. Usually we go into outcome or impact evaluation. What about evaluability assessments, thorough reviews of theory of change, of programs, understanding the programs? So to say again, when posed against environmental obstacles or blockages during COVID-19, we were also forced to rethink. And when we look at equity and at transformation, evaluation can also be used in a very powerful manner by looking at other methods that will not bring you to the number that, of course, captures attention, 20% increase, but that can give you a very strong insight into beliefs, processes, program. I will cite the contribution analysis, which is one of the methods that is a big headache to apply, but it gives a lot of insights about what happens within a program. Third point, speaking to equity, it's about engaging those who are parts. We used to use this word beneficiaries, or I would say right holders, but essentially engage them. Not only in the program, but also in the evaluation. What we think we need to evaluate is not necessarily what they think we need to evaluate. So we have examples, a program, Wabiman program, that looked at leveraging ASHAs and ANMs and promoting a package of interventions in the community for women, through women. It was, I'm not going into the program, I'm going into the evaluation. The women, the healthcare workers, the ASHAs, the ANMs, everybody was consulted, and I'm sharing an example, in designing the evaluation. And so mechanisms were also inbuilt to give back the results to them. So this, again, if we want transformation, we need to think this way a bit more. It costs more effort, more time, more resources. Not always our donors or our counterparts are ready to wait so long or to accept what comes, but it's fundamental if we want transformation. Fourth and last point, I have reached my time, is about institutionalizing capacity for evaluation. And I think as UNICEF, as one of the possibly many partners, but we really try and work with NITI Aayog, with DMEO on this, and also with other partners. It doesn't end up at that level. There needs to be capacity across systems. And we try and continue and will continue, hopefully post-COVID, to do this more and more. To close, again, I'll go back to my point of the victim and perpetrator. Evaluations are a great tool and will be a great tool for equity transformation. From the hat of the evaluator, I would say we need to be solid in methodology, credible, and we need to get it done timely. Otherwise, maybe the policy has shifted before the evidence, very common, has arrived, has landed on the right desk. I see this not every day, but fairly often in my work. But when I look at it with the hat of a program person, I would say, evaluators, I will come to you like this. So please talk to me, with a very simple language. I may not understand the techniques you are bringing to me. So make sure that your sister or your son can understand it, and then maybe your counterpart will. Second, be prepared to get resistance and use your golden minute. No one or few of your audiences will read your marvelous 200 pages report with all the best methods in the world. But you have those moments of the PowerPoint, the sharing in a room. That is your golden opportunity. Not to say that the report doesn't need to be up to marks, don't get me wrong, but it's about how you convince me goes beyond the science. There is a communication and a translational science there that you need, and that's my pitch to you, to apply. Otherwise, and so let me see, next time I meet you as evaluators, I'll be still the chief of health of UNICEF and see whether you convince me about the changes I need to make. Thank you so much, and good luck for the rest of it.
Thank you so much, Mr. Luigi. Our next speaker is the South Asia Region and Global Monitoring Evaluation Learning Director for Women Lift Health. She holds over 13 years of experience in social policy and development research and has been focusing on improving gender equality in health in India. Dr. Shagun Sabharwal has led a diverse range of projects on supporting government efforts, building capacities under monitoring and evaluation, and extensive technical advisory on evidence-informed policy design. Please welcome Dr. Shagun Sabharwal.
Thank you, everyone, and a very good afternoon. It is indeed a pleasure to be here with all of you and to actually be in person for this, comeback of COE in-person event. And I really applaud the organizers for also selecting the theme, which is so relevant right now. And I'm going after two very articulate speakers who have touched upon some very, very important themes, and you will see those reflected in what I share with you today as well. I have taken the liberty to make slides because I felt that just helps us keep structured, but I promise you they're not more than 5, and I will not bore you. So I think the thing I want to start with, though, is my own personal journey as an evaluator and where I stand today. And I think in the evaluation space, we are all about what is happening out there. We want to maintain that credibility. But in my new role, I'm learning the importance of bringing together the personal and the work that you do, and how that itself can create so much reflection and learning opportunities for all of us. So I will begin by saying that even though I'm talking about my personal journey, how it is sort of linked to the theme of what we are going to talk about today. And the first thing I want to say is that as soon as when I was doing my PhD, obviously as a doctoral student, you want to, do your thesis, you want to publish your papers, you want to have a job market paper. And so you are drawn to what is accessible to you, which are these large data sets. And these are usually nationally representative data sets. So it began from that point of view, where I started working on large data sets to, and again, look at something which was about gender equality, the whole idea of son preference that exists in India. And then as I moved into my postdoctoral fellowship, I started working with primary data sets, but these were again cross-sectional surveys which had been collected, again fairly large, but they are not openly available to everyone. And I had access to those to again bring out research papers, think about, okay, what are some correlations that are important to think about. After that, I moved towards doing something which is about impact evaluations and also building the capacity as when I was at 3IE to think about how we can do quality assurance, how we can launch RFPs, build the capacity of the overall ecosystem in evaluation, impact evaluation space. And then I moved into a space where I started working very directly and closely with governments to see whether we can scale evidence-based solutions and impact people and go to scale and the kind of things that, Dr. Sonalde also just touched upon. And finally, now that I'm working more as a head of an organization where we do more programmatic work, but also leading global MEL work, I'm realizing that I'm straddling both the spaces that we just heard about, the programmatic and the evaluation. But in all of these things, I also want to say that who were the main target people that I was trying to influence with my work, right? In the first few phases, it was about journal publications. It was about getting it out in peer-reviewed journals. And it is very important to address that because when we think about evaluations, there is also that academic lens that comes in where the incentives are many times about doing things which are, which have not been done before. This is how you get to a journal, right? And then as we start to move, you start also thinking about maybe the evaluation community at large, about donors and program organization, finally thinking about what are the incentives of the policy makers, what are their needs, and finally moving to the clarity that it is the direct participants, those whose lives you want to transform, who are at the center of all of this. And many times as evaluators, we become very far away from that key point. So what I'm trying to say is that even as we are evaluators, it is ultimately of programs, interventions, even if we are doing descriptive studies, it is to understand the lives of certain groups of people whose lives we want to transform. And that centrality is actually closely linked to the theme of today. And so my main argument is that when we look at the theme of equity and transformation, it is all about the primacy of whose life we seek to impact and change, and how the current evaluation ecosystem needs a paradigm shift, because we completely forget to give primacy to that in many times. We become so, we are having demands from the donors, we are having demands from our program partners, and it just becomes about collecting data, publishing reports, doing impact evaluations without really trying to understand the processes, the pathways through which this change is likely going to happen. And why now? So it is not that inequalities haven't existed, because when you look at the theme of equity and transformation, by definition, you are talking about the power structures that are existing, the power asymmetries that are existing. And it is really important to call these out even in our evaluation methodologies, rather than just having those blank templates. So the pandemic has definitely drawn attention to the inequalities that have already existed, but now it has caught the imagination of the mainstream. It has become something which has been a reality check for a lot of people. So this is the moment where we need to have this conversation about how we need to have a paradigm shift for the evaluation ecosystem. So for me, I feel the underlying principles in this newly imagined evaluation ecosystem that I want to kind of argue for is that we have to again start with the question. So the question is, what do we want to evaluate and for whom, right? So we have to start understanding the outcomes of the groups in a more contextually relevant way. And this is again, what I feel is that many times we plunge in, we do literature reviews, we do some landscaping work, and then we plunge right into the design of our programs, interventions, and solutions without doing enough to go out there and really talk to those people or understand and get more contextualized nuances on the barriers and problems that need to be corrected. So I think I feel it's very, very important that the evaluations become more locally led, they become more contextually relevant. And that is something and for that, of course, there are costs associated with it, but without doing that, you're again doing a very top-down kind of an approach and then bringing in the evaluation lens there. The second is that we need to gather iterative feedback from this in order to learn and adapt. And this lack of feedback loops within the evaluation system is also a huge problem, because you can collect your baseline data, then you come in at the end, you collect end line, and we should be triangulated with monitoring data that we are collecting. But at the same time, it's important to keep going back and telling what's working, what's not. I know one of the things is that we have to be credible, which means we don't influence what is working and what is not at all. But I don't think that is the way to go anymore, especially when you're working with policymakers or looking at highly complex programs which are beyond the proof of concept stage. So I'll make it a little bit, whatever I'm talking about may seem very abstract, but I want to now bring this down to talk about the 4 principles that I have obviously been alluded to and give examples on what I mean for each of these. So when I say contextually relevant, it really becomes, and Dr. Sonalde also talked about the measurement aspect, right? So even how we start to measure some of these indicators, some of the outcomes itself can be very different based on who you are talking to and their context. So let me give you an example of this, because especially when it comes to gender, context is not just a factor that you have to keep into mind. It is very, very primary, because an empowered girl living in Delhi is very different from what an empowered girl living in Patna would be, or an empowered girl living in Sitamarhi district would be, or an empowered girl living in New York would be, right? So the gender is in a way a construct that is highly influenced and shaped by the norms and the context in which the women and the girls are living, right? So to give you this example, I'm doing this work with the government of Bihar, where we are working with ultra poor women who are usually single women. So these are women-headed households. And we are trying to kind of help the government scale up this program, which has been hugely successful across the world, which was pioneered by BRAC in Bangladesh. It's called the graduation approach. It's also called targeting the ultra poor. And the government of Bihar is scaling this program in all of its districts, and it has already reached 200,000 households. It's a fantastic program, and we are working with them as a knowledge and learning partner to support them to collect data and ground truth their work, because it's a massive program and it's again highly participatory in nature. So when I was doing my fieldwork many years ago, we wanted to have questions on women's empowerment, and the typical NFHS data questions, or generally if you look at empowerment indicators, they are usually a scale which talks about women's ability to mobility, their ability to go out of their households, go beyond the village, their ability to have control over their own savings, so economic empowerment. And finally, there is also the last one is on decision making. Are they taking household decisions? So when we would use those indicators, we would see 90% of our sample is empowered, because women are high on everything. So are we working with a highly empowered group, right? Now, when I went for my field trip and I talked to a lot of these ultra poor women, what's actually happening is that since these are women-headed households, the entire burden of earning for the family, taking care of the kids, going out, and if there's any emergency, they have to run and get the medicine. Because they don't have any other choice. They have zero support system. They are extremely poor, don't have a support system. So they are highly disempowered. They have so much time poverty. They have so much cognitive burden. But yet in my sample, they're coming out to be highly empowered. Because in this context, mobility is not a problem. There is no one else. They have to run around for everything. So all I'm trying to say that even the metrics that we use are so much shaped by the context. So for them, and it's not about just qualitative versus quantitative, it is about doing that extra step and saying, does this metric really work in the context I'm trying to do, or even understanding that. Second is this thing of intersectionality. Now, intersectionality has become such an important, it's a buzzword almost. And when I look at, again, these ultra poor women, for me, they're women. So there is we want to say, okay, we are working with women, we're trying to empower them. They're ultra poor, so there is an economic aspect to their identity. But then how does caste start to play a role? And there again, we saw, because as a part of our program, we are supporting them to have their own enterprises, which they can do. So they can open small shops, etc. Right? And what we saw that in certain households which were not being able to get there, it is in some cases that when women are trying to sell their products, then other households who are from higher caste are not buying them. So there are these caste things that also start to play, but we don't mention it. So it is very important to have that intersectional lens even as evaluators. Otherwise, we will start to miss out on a lot of this, right? The third thing I want to talk about is power. Now, power, of course, we all think about, and the question is like Nella Kabir's framework on power is again very, very powerful. And it is definitely about women's empowerment, but also applies to many other marginalized groups. And here I again feel that as evaluators, we need to also think about power as being something which is relative, right? So within that context, so our work is in Women Lift Health, we work with mid-career women leaders who may come across as who are working in health and are highly empowered in certain metrics. But again, within that institution, what does the power dynamics work, right? So that is the third thing I wanted to say. And finally, I do want to bring in this idea of decolonization, which is really more about the evaluation ecosystem rather than just about evaluators, because a lot of the models that we are looking at, the paradigms are Western in nature. They are not locally made. And it is high time that we start to make this a locally led system. Plus also an urge and plea to the donors to start to again have more of this bottoms up thinking when we are thinking about it, right? So it's not just that, because all of these things take time, they take more money. But if you want to really be transformative, then this is really these are the costs that we really need to have. I'll skip this slide because we have less time. So this is my closing slide. And I think I would just end by saying, which is my pitch to the evaluation community, since everyone's been making a pitch, I'll also make, that we can really play the role of being better listeners. I think many times we come, because we are a technical field, we have certain skills which, are not very widespread. There is also a power asymmetry that starts to happen. So we need to become better listeners. We need to listen more to the programmatic side, which is what my colleague from UNICEF mentioned. And now that I am also having that hat, I'm realizing that that's where you also get a wealth of information that can make your evaluation highly rich, relevant, and transformative. Second, we need to be contextually responsive, is the example that I gave. Always do some level of ground truthing before you design your program and start to, just implement it and evaluate it. Thirdly, have a systems lens. Eventually, the eye to scale, and scale is a big thing, right? Eventually, if you're doing these evaluations, you want them to benefit as many people as it can. So what are the pathways, what are the processes? And I couldn't agree with Dr. Sonalde more to say that is where, again, thinking about process data, thinking about what are these process data telling you, what are the pathways through which this change is happening is very, very important. Finally, being intentional and being purposive. So with this, I'll end here. Thank you so much.
Thank you so much, Dr. Sabharwal. I think we see it echoed a lot, that while some of our ideas are getting reinforced about evaluating in challenging times, we need to rethink about the primacy of who we are evaluating, the locally led and contextual evaluations, and equitable and inclusive participation of systemic as well as other stakeholders is very important as we go ahead. Next, we have a special video message for all of you from Mr. Marco Sigone, who's the director for UNFPA Evaluation Office.
Dear friends and colleagues, I'm delighted and honored to join you virtually today at the 5th Evaluation Conclave organized. I'm delighted and honored to join you virtually today at the 5th Evaluation Conclave organized by the Community of Evaluators South Asia and various partners. This esteemed gathering of South Asian evaluation community comes at a time when the South Asian region, and indeed the entire world, face great peril. From extreme temperatures, drought, and flooding, the climate catastrophe is engulfing the region, heavily impacting the farthest behind. Growing conflicts and divisions are further moving people into poverty. The rising cost of food and energy, unemployment and declining incomes, and the ongoing effects of the COVID-19 pandemics are pushing the Sustainable Development Goals out of reach. The complex socio-economic issues and inequalities in the region are further worsening discrimination based on gender, caste, class, religion, ethnicities, and location. As the world population reaches 8 billion next month, we must reflect on the actions needed and the opportunities that exist to deliver equitable and sustainable development for all. With about 20% of global population living in South Asia, the region must harness the opportunities that come with demographic change for people, prosperity, and the planet. In this scenario, how can evaluation become a force for equity and transformation to deliver an inclusive, equitable, and sustainable future for all? I present to you 4 priorities for evaluation. First, let's sharpen the focus on leaving no one behind. In a systematic and meaningful way, evaluations must integrate the principle of leaving no one behind and reaching the farthest behind, including social and environmental dimensions in evaluation. When evaluation addresses the root causes of discrimination and inequalities, and when evaluations uphold social and environmental standards, evaluations become a transformative force improving people's lives. Second, let's sharpen the focus on adaptation and innovation. Evaluation must adapt to a dynamic environment, utilizing innovative approaches. Consider using new technology and big data in evaluation, new evaluation approaches, methodologies, and evaluative solutions, and adapt evaluation techniques for real-time learning. Third, and very importantly, let's sharpen the focus on youth in evaluation. South Asia is home to one of the world's largest youth populations. This is an incredible opportunity. If we are to achieve an equitable and sustainable world, we must listen to youth, partner with youth, and tap into their potential, including in evaluation. When the power of youth is harnessed in evaluation through meaningful ways, it brings innovation, better evaluation quality, improved relevance, and enhances the transformational power of evaluation. I take this opportunity to invite all of you to adopt the recently launched Youth in Evaluation Manifesto. Today, nearly 500 organizations and individuals have signed the manifesto that calls for committing to meaningful engagement of youth in evaluation. On behalf of the Eval for Action family, I'm thankful to all signatories from South Asia, including the Government of India, the Independent Evaluation Department of the Asian Development Bank, the CLEAR Center in South Asia, just to mention a few. I hope you will join and endorse the call as well. Building on this global momentum and to improve accountability and practice on engaging youth in evaluation, we also invite you to join the co-creation of standards to enhance meaningful youth engagement in evaluation for different stakeholders groups. Last but not least, let's sharpen the focus on evaluation partnership and advocacy. This is because no one can deliver on these areas alone. We need multi-stakeholders, inclusive and intergenerational evaluation partnerships and solidarity during this challenging time. In this spirit, I once again congratulate the community of evaluators South Asia for bringing together the evaluation community in the region for knowledge sharing, collaboration, capacity development, networking, and advocacy. As only together we can build the capacities of nations and regions to deliver and utilize high-quality evaluations for enhanced equity and transformation, leaving no one behind. Thank you very much.
That was Mr. Marco Sigone. Our next speaker is our guest of honor, who's presently the Director General with the Development Monitoring and Evaluation Office, NITI Aayog, Government of India. He joined the Government of India in 1996 as a member of the Indian Economic Services and has been part of evaluation of many government schemes as part of the Program Evaluation Organization of the erstwhile Planning Commission. He's also worked in the areas of industry, infrastructure, public finance, and macroeconomics during his stints with the Ministry of Finance. He was involved in managing India's development partnership with Africa as part of the Ministry of External Affairs. Before joining DMEO, in his last stint, he was an economic advisor to the 15th Finance Commission of the Government of India. Please welcome Mr. Anthony Syriac.
Distinguished audience, thank you very much for inviting me first. I see three key words in today's topic: equity, transformation, and challenge. I take challenge first. Challenge perhaps comes because we are in the COVID era. I don't know whether it's post-COVID or not. Mobility has a problem, evaluator has a constraint. Hence, it's challenging to mobilize evidence. Equity can be thought of in different ways, according to me, because when we talk of equity, we talk about equity in the implementation of schemes and in the final outcomes. But then let me try to give a different perspective to it. Now, Government of India's total budget is rupees 40 lakh crore, out of which the schematic expenditure is roughly around 15 lakh crore. So 15 divided by 40, it's 38, roughly 40% of the total expenditure. What is the remaining 62%? It's establishment expenditure and other expenditures which are part of the commitments of the past, interest payments, etc. So then I am always going after this 38% and the equity in the spending of 38%. So connecting it to public finance, equity has a sense of intergenerational equity also. So the spending that I do, I mean, can I evaluate how evaluable is the remaining 62%? It's also important. Otherwise, I don't create enough space for schematic implementation. And of course, I'm not underestimating the importance of the other aspect of equity. And there is no greater goal in a country like India, where we have inequalities of different dimensions, that developmental schemes should focus on equity and evaluation should be equity centric. So this is the first point that I wanted to make. The second is the context in which we do evaluation. I speak as a practitioner. I am not an evaluator per se, but I don't see that as a formidable constraint to my being effective, because to the extent that I am able to understand what the evaluator says, I can hire expertise, and I should be able to understand their language, their techniques to the extent I require. Hence, my problems are slightly different. As a practitioner, my problems are slightly different. And the context is that there is increasing demand for evaluation. Among all the policymakers of the country, I see there is a spurt in demand for evaluation. Now, how does the evaluation community meet that demand is the biggest question. To take again the Government of India example, there are close to 900 schemes of the Government of India. A big state like UP has about 1,000 schemes. Karnataka has as many. So this program space is very dense. The scheme space is very dense. Now, if I'm to formulate an evaluation cycle and evaluate all these schemes over a finite number of years, I mean, now if it is a 5-year cycle, it is 800 by 5. My task is cut out. So that is close to 200 evaluations per year. Now, if I come out with an evaluation study after 2 years, there is no taker for that. So hence, and at the same time, when I give the evaluation report, the focus is on quality. You give all these conclusions, and where is your diagnostics? And what is the policy option? So I should go in. So the trade-off between timeliness and quality is the most important challenge that an evaluator faces now. Because the program space is so dense and the demand on me is very high, and hence I should deliver on time and with reasonable levels of quality. Hence the problem with techniques like RCT, etc., when the program space is highly dense, and every aspect of social policy is touched, the effectiveness of that touch is it's a different question. But so now timeliness versus quality is the biggest question that I face as an evaluator. Second, survey research versus evaluation. Again, I'm just going back to what Professor Sonal mentioned, that, and all the speakers echoed also, that the generating a statistic is not the purpose of evaluation. I can be statistically precise on my survey, but then why does my data behave in a particular way? I should have a credible explanation for that. And my data behaves in a particular way, my processes are failing, my schemes are failing. Why are they failing? And what is the alternative? Alternatives cannot be transplanted from outside. Is it conducive to the alternative that is suggested? Is it conducive to the political economy of my system? If I don't answer these questions properly, my study gets relegated to the background. So the challenge actually is this. Challenge is not that I missed physical contact with my right holders or the beneficiaries over the COVID period. The challenge is actually this: I should meet quality, I should meet quantity, and I should meet diagnostics requirements, and I should give policy alternatives. Now, and again, what are the challenges within these challenges? Now, if I see as a practitioner, now if I take 1 year on a study, I see that I spent almost 7 months on procurement. And why is that happening? Procurement processes are difficult. Why is that happening? It is happening because the evaluation expertise, again, the survey expertise versus the evaluation expertise. The evaluation expertise is very limited. I mean, this is what I feel. Evaluation expertise is very limited in the country. Perhaps even the survey expertise itself is an oligopoly in India. So, and then given these circumstances, what is more important is that I should widen the expertise across the country. The grassroots level academic institutions of the country will have to come as crucial players in implementing evaluation studies. Then participation, community, all these loops can be bridged. So that's, I mean, this is something that we are starting in a humble way to engage with the universities, so that we have to the grassroots level universities, not the top level ones, the grassroots level universities, so that we have expertise geographically represented, sectorally represented, and quantitatively adequate. And then a last point on it. Now, if I take a scheme is as good as it's the organization that implements it. Design of the scheme may be good, but the scheme design may not result in expected impact because the process, the organization and the processes being executed by the organization are not good. And hence, schemes cannot be seen in isolation. Organizations need to be evaluated. So do we have credible frameworks for organizations of different dimensions? I don't think we have enough. So that's a challenge for the evaluating community to make credible frameworks. Now, the framework that works for the power sector regulators cannot work for a food procuring organization. So this sectorally distinguished frameworks for organizational assessment and linking the organizational efficacy to the schemes under implementation by the organization. This is a constraint that I feel as a practitioner. Hence, I want to emphasize 4 points here. One, timeliness, the trade-off between timeliness and quality. Second is the question of equity enlarged to the concept of intergenerational equity in public finance. We should not confine ourselves to doing only schematic evaluation. We should evaluate the public expenditure assets. Then 3, survey research versus evaluation, the absolute requirement for fostering evaluation expertise across the length and breadth of the country. And then the need for credible frameworks for organizational assessment. Thank you very much for hearing me.
Thank you so much, sir. You've given us a lot to think about. I think we have really relevant takeaways of the dilemma of timeliness versus quality, widening the horizons of evaluation, the expertise and the requirements, how well are we meeting them and how do we meet them, and sectorally distinct frameworks are just some key takeaways. Next, we have a really important born out of all of these experiences that you've been listening to. We have another product that we would like to introduce you to that has been born out of the experiences of some of our board members. I'd like to introduce and welcome Dr. Sonal Zaveri to the stage and Dr. Rajiv Nandi for launching the book Local Wisdom Matters, which is reflections on the evaluation theory and practice from South Asia's experiences. Ma'am. Would you like to say a few words?
Yeah, so I think let's first show the book to the audience, maybe.
Thank you very much. And it's indeed a great pleasure to launch this book, we landed on this title of Local Wisdom because we wanted to talk about approaches of evaluation in South Asia. What is it that makes us unique? What sort of evaluations are relevant and make sense to us? So we've been talking about this for a long time. We talk about contextual evaluation, we talk about indigenous, we talk about culturally relevant. But when we started thinking about what to title this book and the papers that are there, we landed on local wisdom because we are a land of microcultures. We have diversity in our DNA. So how is it that we can express the very relational type of that experience that we have in our communities? We are embedded in social capital. Can an evaluation approach reflect that? So we were very fortunate to get a grant from the Eval Partners Innovation Fund that happened in 2018. And we were able to talk to thinkers from all over South Asia. So we have people who have contributed to this book from India, from Nepal, from Bhutan, Bangladesh, and Sri Lanka. Each one of them stalwarts in their own practice. And this book gave them some time to think about how they're doing evaluations and how could we frame it in our own contexts. However, COVID happened, and so this has been delayed quite a bit. We didn't have our conclave also at that time. So we felt this is really important because we have now young and emerging evaluators. So we want to expose them to new ways of thinking. We talked about local solutions. How do we do that? And so we hope that these various articles over here will have a food for thought. The last article is where we have brought it together to frame what we mean. And we have made it into a very simple framework that we hope that can be adopted by everyone. You could use any methods or tools. But the idea is that it's participatory, it's people-centered, yes, but how are you going to do that? So we have three guiding ideas. One is to be with the people, and we have explained how you could operationalize it. Hear the people. We heard a lot about listening. Hear the people, also hear what they don't say as well as what they say. And then speak with and for the people so that we can reflect the voices from the ground up and we can make a difference. It's also positioning evaluators in our region in a different role, not as experts, but as fellow people, fellows who are on the journey of evaluation, using evidence and making lives better for all of us. So we wanted to also frame both the evaluation and the role of the evaluator in a more contextually and relevant way. So I sincerely hope that you will go through these articles. We'd love to get your feedback, and we hope that this is just the beginning and we'll have much more writing, literature, and thinking about how can we make our evaluation in South Asia truly our own. Thank you so much.
Thank you so much, Dr. Zaveri. Listening to the experts and the experiences from the book, next we have something offering for all the young and emerging evaluators who want to learn more about evaluation, who are stepping into the field, are slightly wary from what I hear. But fear not, we have a certificate course we'll be launching on monitoring, evaluation, and learning for development professionals. I'd like to invite on stage the CEO of Sambodhi, Mr. Dharmendra Chandokar, to release the brochure certificate for the course, as well as tell you something about the course.
Thanks, Shikha. Sabhi ko namaskar. I've been part of all the COE conclaves, and I could vividly recall the very first one in 2010 in the opening session. It's a privilege to be here. It gives me immense pleasure to announce the inaugural offering of the certificate course on monitoring, evaluation, and learning for development professionals by Sambodhi. This is the brochure. There's a copy of this brochure in all your the conclave dockets. And if not, please do collect it from the registration desk. I won't go into the need and rationale of this course. Everybody before me has talked about the need for capacities and starting from being contextual to, as Shagun has talked about, decolonizing evaluation. But I will briefly introduce the course. This course is an online instructor-led 18 weeks modular course for young and emerging evaluators, culminating into award of a certificate upon successful completion. The course is practice and practitioners at its focus, contextualized to the realities of the Global South, and aims at imparting ready-to-use skills for facilitating ME and L functions in projects and organization. The course design dovetails theory and practice and presents an optimal mix of academic rigor and contemporary practice, and the design reiterates the Sambodhi principles of instructional design. Maine suna bhool gaya, maine dekha yaad raha, karke dekha samajh gaya. I hear, I forget. I see, I remember. I do, I understand. This course per se is a hands-on and, as I said, skill-focused, while consequently expanding knowledge and building perspectives. In-person training has been a forte of Sambodhi and has been core to our field-building initiatives for the past 15 years. This course per se is a synthesis of all our learnings and also our graduation into the online realm. One more step for furthering the centrality of data for decisions and evidence for policy, and fostering a culture of measurement learning and adaptive management in the Global South. Please share the course details with your friends, colleagues, and in the network so that it reaches a diverse audience which is rightly fit for attending this course, and they can leverage this course for their professional work and their careers. Also, do share your thoughts and how we can enrich the course and make it an immersive learning experience, rewarding investment for career advancement, all towards our collective quest as a community of evaluators for enhanced effectiveness, accountability, and equity in development outcomes. Thank you very much.
Thank you so much, Dharmu sir. Towards the end, while you have listened to the experts and talking about the evaluations in challenging time, focusing on equity and transformative, we also have a few panels ahead scheduled, which will be talking about further different issues that we have faced and coming from the experiences of different evaluators across the community of evaluators countries in South Asia. Lastly, I would like to invite Dr. Rajiv Nandi, who's also a board member of the community of evaluators and vice president at Sambodhi, to propose a vote of thanks and conclude this session.
Thanks, Shikha. Namaste. Distinguished guests and delegates. It's my privilege to propose a vote of thanks on this occasion of the inauguration of the Evaluation Conclave 2022, Equity and Transformation Evaluation in Challenging Times. I, on behalf of the Organizing Committee, Community of Evaluators South Asia, and the host organization, Sambodhi, extend a very hearty vote of thanks to our guest of honor, Sri Anthony Siriaki, our distinguished keynote speakers, Professor Sonali Desai, Mr. Luigi Di Aquino, Dr. Shagun Sabrawal, and all the delegates and speakers and resource persons for gracing this occasion with your presence and support. Friends and colleagues, Sri Anthony Siriaki, the Director General of Development Monitoring and Evaluation Office of Niti Aayog, is one of the top evaluation experts with the Government of India. With his unique experience of both designing and executing policies and programs on one hand, and monitoring and evaluating the government programs on the other. Since he joined DMO in 2020-2021, I had a few opportunities to interact with him and always showed enthusiasm in promoting India's evaluation discourse and enhancing the evaluation systems in this country. We are immensely thankful to him for gracing this occasion with his presence and his valuable inaugural speech. We'll remember your valuable suggestions during this conference and beyond while drafting our future agenda. We extend our gratitude to Professor Sonali Desai a great social scientist, and known globally for demystifying social inequalities with a particular focus on gender and class inequalities. Your keynote speech set the tone for the event, Professor. Sagun Sabrewal is an old friend of the community of Evaluators South Asia. When she reached out to me to know more about this conference, and I used that opportune moment. I thought it would be a good idea to invite her for a keynote and hear more from her about her recent work, which is very closely aligned with the conclave's theme. So my personal thanks thanks go out to Sagun for speaking today, sharing valuable ideas for practitioners and policymakers. Thank you. From the beginning of the WOP movement in South Asia, UNICEF was there. In the early days of COE, when they provided excellent support to set up a network called Teaching Evaluation in South Asia, TESA, in alliance with a number of academic institutes across South Asia. We are happy to see the partnership between COE and UNICEF is continuing. It's wonderful to have Mr. D'Aquino today, who highlighted the importance of community-driven monitoring, institutionalizing, methodology, so all very important aspects of evaluation today. Mr. Marco Sigani is a dear friend and a great supporter of OP movement. He always keeps motivating us, the evaluation warriors, all the time with his leadership qualities and innovative ideas to make evaluation meaningful, transformative, and influential. Marco couldn't join us today live for the time difference with his current location, but very kindly accepted our invitation and shared a thought-provoking and suggestive analysis of the concept note of the event. Shio is thankful to Marco for gracing this event with his recorded speech and valuable inputs. We are delighted to see Dr. Reshmi Agarwal, the co-leader and founder of ECOI, Dr. Janvi Andria, the director of Institute of Social Studies Trust, our event partners, many other OP leaders and evaluators, both young and emerging evaluators and experienced practitioners here today. Our sincere thanks go out to all of you. Dear delegates, we're extremely happy to acknowledge your support and guidance as we continue to struggle to make our evaluations accessible and usable, to make decisions and to ensure genuine participation of all stakeholders to make use of evaluation for better performance. We are immensely thankful for your participations. Over 300 people registered from different technical sessions of this event. This includes, this indicates a growing evaluation community in the global South who are keen to participate actively in learning, sharing, and using evaluation findings in achieving the development goals. Finally, we thank all our partners and sponsors, IDRC, Bill and Melinda Gates Foundation, Rockefeller Foundation, United Nations Population Fund, and UNICEF, and our event partners, ISST, MERL, Evaluation Community of India, and ARTHAN. As a result of the financial and technical support, we are able to organize such a huge 5-country event and provide bursaries to most of our participants to attend the workshops and technical sessions. Before I end my vote of thanks, I like to mention the great contributions from our team at Colombo, particularly Dr. Ranjit Mahindapala, the Conclave director, the team at Sambodhi and at ISST. They have been working relentlessly for last 2 months, and this is the result today. We are now looking forward to a great conference in the next 3 days with rich presentations and meaningful discussions. We are sure that the event will be one of the key moments in the history of COE South Asia towards bringing transformation and equality for the well-being of this planet. Thank you so much. And please join us for the technical sessions at 4 p.m. today. Thank you.